Welcome to the Florida Autism Center. I'm Chrystin Bullock. I'm the founder of FAC. Florida Autism Center is a community of caring professionals in beautiful spaces working to make a difference for children and families every day. I feel like there are a lot of children in our community who just need a little bit extra. They just need a little bit extra, a little time and attention to really help them reach their full potential. And I always felt like if I just did private practice, if I just went and saw the kids that I could see, you could touch the small little window of children. But if we created a place where we trained other people to do that too, then we could reach a lot more kids in our community. I wanted to really focus on serving very, very young children. So our youngest child that we take is about 15 months old, up through that, 5 or 6 year old mark when they go into kindergarten. And I felt like we had some nice options, but we didn't have an option that really incorporated the social skills in the way that I think is appropriate for young kids to be playing and learning. And I felt like we needed a really nice social setting for the children and a really nice place for them to come and feel comfortable and feel at home and bring their families into what we're doing. We work very hard to do centers that our kids come in and they get an opportunity to do circle time and to do things that look more like what they might experience in private or public school in a more typical classroom, but we give them the opportunity to do it with the support, with the one-on-one individualized support of somebody working just with them. We tailor everything that we do specifically to the child in front of us and to their needs, so it's not cookie cutter. ABA therapy is individualized. It is scientifically based, so there are published research studies that say we have used these procedures with these type of kids and they've been overall effective, and we've been able to demonstrate that. And so what we want to do is we want to replicate those procedures and expand upon those procedures so that everything we do with our kids is not our best guess as to what we think will work, but what research and history and decades of training specifically in how do kids with autism learn. This is the kind of therapy that we do. In addition to early intervention, we do one-on-one therapy, which can sometimes be after-school therapy for kids who just need a little bit of extra support. It can sometimes be full-day therapy for kids who need a lot of intensive help learning daily living, self-care kind of skills. In addition to one-on-one therapy, we have school here. It's a very small private school program. We keep it really small purposefully. So we want it to be for kids who really might have trouble in that big, 22 student classroom. We want to give them a classroom with 2 or 3 students with real individualized attention where they can work on grade level toward their own goals, what's going to really be beneficial for them. Our goal here is we want your child to outgrow us. We want your child not to need to be in a therapy setting like this. We want them to come in and we teach them everything that we can teach them, and then they go off and they do it on their own. And the very best endorsement that I think that we can have is a parent who says, I went there and I don't need to go there anymore.